basically, I work on a as-needed basis. I have, for over 30 years, had a mobile surgical practice, and I am a diplomat of the National Dental Board of Anesthesiology, and have a traveling license. And so I work with a number of dentists who like to have a little more control of the environment, so they kind of know what's happening with their patients and kind of know the level of care they're receiving. And for those that are anxious, or the ones that they feel like they'd like to, who don't feel as confident in different environments, I come into the office and I come in with my registered nurse, and we have every bit of equipment you'd see in a hospital. And we come in and interview the patient and kind of get them comfortable, and then we go and put them to sleep, and then we move forward. But it's kind of an opportunity for Dr. Miller to kind of have his hand on the pulse of the situation as it presents itself, and that way it's a little bit higher level of feedback the patient has with my situation, my variety of practice, type of practice.